Smoking is horrible for your health and your looks. That should be nothing new. But there's been a slow uptick in vaping. In schools, on campuses, and for people struggling to quit. It's supposed to be a safer, lower risk alternative. One that shouldn't ruin your teeth and age your skin, right? Wrong. It turns out that vaping could be just as bad as smoking for your long-term looks. Do you know what vaping and smoking are doing to your skin? Let's find out. We've known for a long time that smoking can negatively impact your appearance. In the short term, it can cause things like yellowing of the teeth, skin, and nails, and a black hairy tongue. And in the long term, you can see things like dry skin, uneven skin tone, sagging at the jawline, eye bags, deeper facial wrinkles, and furrows. A 40-year-old heavy smoker's skin can be comparable to that of a 70-year-old non-smoker. Think about that. Photo aging software now allows us to show the effect smoking has over time. The negative effects of smoking aren't immediately visible. If they were, it wouldn't be such a persistent habit. But when you look at what smoking does to someone's appearance over, say, 15 years, the effects are profound. Smoking makes skin less elastic, firm, and plump. Tobacco components stress out fibroblasts. As a result, fibroblasts reduce collagen and elastin production. Smoking constricts and narrows blood vessels, which reduces blood flow, and that can even cause things like hair loss. Reduced blood flow leads to less oxygen and nutrients reaching our organs, including our skin. Smoking also increases free radicals, which can damage our cells. It reduces the amount of vitamin A in our skin and our total levels of vitamin D. Smoking can also increase the severity of various skin diseases such as psoriasis. Smoking is well known to inhibit wound healing. This can lead to persistent sores, and that in turn leads to the increased risk of infections. Smokers are also more likely to reject skin grafts when they are used. Smokers have an increased chance of getting gum disease and are not great candidates for dental implants or gum grafts. There's also a much higher risk of head and neck cancers in smokers compared to non-smokers. And earlier in my career, I dealt with a lot of these head and neck cancers from both a resection and oncologic perspective, as well as a reparative and reconstructive perspective. And I can tell you that those surgeries are very different from the aesthetic type of procedures that I do now. Reconstructive plastic surgery after a cancer has been removed is very challenging, and it's very difficult to create aesthetically pleasing results, even in the best of hands. So the best thing you can do is to be preventative and to try to reduce your risk of getting these types of cancers in the first place. And you know those skincare products and those cosmetic procedures that we talk about to help mitigate aging and to help care for your skin? Well, smoking counteracts all of that. But vaping should be okay, right? Sadly, a lot of people have that opinion, that because vaping doesn't produce the same smoke as cigarettes do, that somehow they're a healthier way to get nicotine. Well, think again. For a long time, we weren't sure how smoking actually damaged our skin. There's a lot of bad stuff in cigarettes and tobacco, so it's hard to exactly parse out what's doing the most damage. Also, the tobacco industry of course spent billions trying to downplay these risks. Well, there is a primary culprit in tobacco that works to wreak havoc on your skin. Can you guess what it is? Drum roll, please. Nicotine. Nicotine is a highly addictive drug that causes the release of dopamine in our brains, and that makes us temporarily feel good and keeps us coming back for another hit. Nicotine receptors are expressed on skin keratinocytes and fibroblasts, your collagen and elastin producing cells. When it binds to them, it causes them to produce less collagen and less elastin. Nicotine, as it turns out, is a vasoconstrictor, which can potentially reduce our ability to heal wounds. And nicotine is absorbed by our skin, intestines, and mucosa. So secondhand smoke, for example, is not just dangerous because we're inhaling something that is coming through our lungs from the environment, but also when it sticks to our clothes, such as our t-shirts, and then we're wearing those shirts around, there's going to be some absorption that's happening from those t-shirts that have, say, nicotine on them, and now that's being absorbed through our skin into our bloodstream. What this means is that nicotine has the ability to affect important cells that are important for our skin health, and it has the means to reach them. But nicotine doesn't have to come from cigarettes. Vapes or e-cigarettes containing nicotine will have the same effect on your skin. The sum effect is poor skin quality and premature aging. All around, nicotine is bad news for your skin. And anytime I'm doing consultations in my practice, I always ask patients if they smoke or if they consume nicotine in any other way. And if they say yes, I highly recommend that they come off of the nicotine for at least 2 to 4 weeks before and after surgery to optimize their wound healing. And we have a video dedicated to scarring and wound healing so you can better understand the processes involved and how nicotine or cigarettes can adversely affect that process. Make sure to check out that video. And we've known that smoking is damaging to our bodies since the 1960s. In 1964, U.S. Surgeon General Luther Terry issued a definitive report that linked smoking cigarettes with lung cancer. And I found it super interesting to learn that this 150,000-word report was assembled by 10 scientists, half of whom were smokers, and was released on a Saturday, partly out of fear that the findings would potentially disrupt the stock market. So why the interest now? Well, nicotine is making a comeback as vaping in colleges and high schools. They even have a term for it: vape face. Once people start vaping, they seem to have more skin breakouts, wrinkles, and dehydrated skin. As a side note, in my research for this video, I found out that nicotine has been scientifically linked to increased rates of erectile dysfunction. I found it interesting because I prescribe and talk a lot about finasteride on this channel, both what it can do for preventing further hair loss, but also its potential side effects, including erectile dysfunction. This is an important reminder that there are usually numerous contributions to sexual side effects, and nicotine can be a culprit for some. Part of the rise in popularity is the misinformation about smoking and nicotine. People say nicotine is anti-inflammatory. Isn't that a good thing? Well, in some instances it might be, but that isn't necessarily the case. Some inflammation is actually good. It's necessary to start wound healing and to protect us from infections. Historically, tobacco was used as a medicinal herb to stop bleeding, treat inflammation, and various other ills. Well, this rhetoric gives a false sense of natural healthfulness, but we have better options in modern times for these maladies. And people have this perception that because e-cigarettes don't produce smoke, that there's somehow a healthier way than cigarettes to deliver nicotine. But that's not entirely true. Nicotine itself is damaging, though it does seem less likely to cause cancer compared to natural cigarettes, based on what we know today. Remember that vapes and e-cigarettes are often laced with other chemicals, such as artificial flavorings, which can potentially irritate, for example, the linings of our lungs. So what are some ways that someone can try to kick the habit? Options include nicotine replacement therapy, avoiding triggers, delaying giving into a craving. Oral fixation can sometimes be remedied by chewing gum, avoiding the just one pitfall, physical activity to serve as a distraction, meditation and other relaxation techniques as an alternate stress-reducing method, social reinforcements and proper support groups, online support such as stop smoking programs. Try to focus on the positives of stopping, such as the massive health benefits to both look and feel good. And if you do smoke or vape, here are some of the things you can try to do while you're still working on quitting. Gentle skincare, such as our Feel Confident skincare line, including a gentle facial cleanser, an HA serum, and a facial moisturizer. Proper sun protection, and serums with antioxidants to counteract free radicals. Consider vitamin C and retinols to help increase collagen production. A healthy diet can go a long way. And resistance training has been shown to boost collagen naturally. Some people ask me if smokers are ever a candidate for cosmetic surgery, whether that be facial plastic surgery, hair transplant surgery, or other body plastic surgery. I think it depends on the procedure and of course the the comfort of the surgeon. Some people, for example, when evaluating a patient for a facelift, will not operate on them if they're active smokers. And I know some surgeons who actually check your nicotine blood levels on the morning of your surgery, and if they're too high, they'll actually cancel your surgery for the day. And specifically about facelifts, some surgeons feel that if you're doing a deep plane approach, you're less likely to have different complications that result from people who smoke or, for example, consume nicotine. So sometimes it depends on the exact technique that's used for your procedure, not just the name of the procedure itself. So I think it depends on the situation. So as a patient, you need to be very forward and honest with your surgeon about your potential nicotine consumption and talk to them, see what they say about your potential increased risks of complications and how long they might want you to be off the nicotine for. Personally, in my practice, I don't check people's blood levels of nicotine. I talk to them about if they're on it or not, and we also discuss the importance of coming off of nicotine for at least 2 to 4 weeks before surgery and only resuming it at least 2 to 4 weeks after surgery so we can get the best possible results for my patients. And while non-surgical procedures such as laser resurfacing, Botox, fillers has overall fewer risks compared to surgical procedures, I think it's also important to discuss your nicotine use with your aesthetic provider if you're getting one of these procedures, because you still might be at an increased risk of complications from these non-surgical procedures. Let's go over some of the procedures that previous smokers might benefit from. Lip procedures can address those lip lines, and we have a dedicated video on that topic, so make sure to check it out. Facelift surgery can help reposition the tissue if the person who smoked has experienced significant sagging over time. Laser resurfacing and chemical peels can often help address skin texture and quality. Many patients who come to me for a cosmetic surgical procedure often say that it's because of that procedure that they're actually motivated now to quit smoking, which is really awesome. In conclusion, if you smoke or vape, the best thing you can do for your skin is to quit now. There's hope to turn back the clock once you stop. Collagen synthesis renews, blood flow increases. It usually takes 4 to 12 weeks to see improvements in your skin after you quit. By choosing to quit today, you're not just taking a step towards healthier skin. You're investing into a brighter, more vibrant future for yourself. Remember that your skin reflects your journey. Let's make it one of health, resilience, and beauty. You've got this.